You know that feeling, right? That nagging, sharp pain from an ear infection? Well, almost everyone's been there. In this explainer, we're going to break down exactly what's going on inside your ear, how to take care of it, and the pretty incredible medical journey that led to the cures we have today. Yeah, we've all felt it. That building pressure, that deep ache that can keep you up all night. It makes it impossible to focus on anything else. But what is actually going on in there to cause all that misery? That's the big question we're going to tackle. So first, let's get the lingo down. In the medical world, any kind of inflammation or disease of the ear is called otitis. It sounds kind of formal, but it's the root of everything we're talking about. And understanding this one word helps us break the problem down into two very different types. Okay, so ear infections aren't all the same. They generally fall into two buckets. First, you've got otitis externa. Think of this as a skin infection, but it's happening inside your outer ear canal. Then there's otitis media, which is way deeper, happening behind the eardrum. And as you can see, their causes and treatments are worlds apart. Let's start with the outer ear first. The great news here is that a lot of outer ear problems are actually preventable. It really just comes down to protecting that super delicate skin inside your ear canal. So let's get into what you can do, and more importantly, what you should definitely not do. I know. It's so tempting to try and clean your ears, but here's the thing. Your ear canal is basically self-cleaning. Sticking things like Q-tips, bobby pins, or yikes, paper clips in there is just asking for trouble. You can easily scratch the skin, push wax further in, and cause the exact infection you were trying to prevent. And if you think I'm being a little dramatic, get this. This quote is pulled directly from a doctor's report. A patient was cleaning her ear, her kid bumped her arm by accident, and that Q-tip went straight through her eardrum. It's a scary but very real example of how a simple misadventure can cause serious, maybe even permanent damage. Now, let's say you do get an outer ear infection and your doctor gives you some drops or antibiotics. This part is absolutely critical. You might start feeling better after a couple of days and think, great, I'm cured. But you're not. The infection is still lurking. If you stop the medicine early, it can come roaring back, and usually it's even stronger the second time. So the takeaway is simple. Always finish the entire prescription. All right, so that was the outer ear. Now we're going deeper behind the eardrum to talk about otitis media, the middle ear infection. This isn't about scratching the skin anymore. This is more like a plumbing problem, deep inside your head. This whole process is invisible, but it's what causes all that pain. It usually kicks off with a simple cold or allergies that make your nasal passages swell up. That swelling then blocks your eustachian tube. That's the tiny channel that keeps the pressure in your ear balanced. When it gets blocked, a vacuum forms, and that vacuum literally starts sucking fluid from all the surrounding tissue, filling up your middle ear. And all that fluid has a huge effect on your hearing. We're talking about a 30 decibel drop. To put that in perspective, that's like turning the volume of the world down by 300%. A normal conversation might suddenly sound as faint as a whisper. It's a really significant, though usually temporary, hearing loss. For an adult, that's frustrating. But for a little kid, it can be a huge problem. This is what experts call an educationally significant hearing loss. I mean, if a child can't hear clearly, they're missing out on all the crucial sounds they need to develop language. It can seriously delay their ability to talk and learn. That's why treating chronic ear infections in kids is so important. So, is there anything you can do about that awful pressure? Well, in some situations, a doctor might recommend a technique called the Valsalva maneuver. It's a way to try and pop that eustachian tube open. It's pretty simple. You just pinch your nose, close your mouth, and blow out gently. But, and this is a huge but, there's a very important warning that comes with this. You should never, ever just try this on your own without a doctor's okay. Seriously, depending on what's causing the blockage in the first place, you could actually make things a lot worse. This is a tool to be used only when a doctor has checked you out and has specifically told you it's safe for your situation. So what happens when that fluid just stubbornly refuses to drain? Well, luckily, modern medicine has a bunch of ways to bring relief. Let's take a look at the options doctors have to clear out that middle ear and get your hearing back to normal. Okay, so sometimes the body just takes care of it. The pressure builds and builds until the eardrum actually perforates or ruptures on its own. Instant relief, but not ideal. More often, a surgeon will step in. They might make a teensy little incision, a myringotomy, to drain the fluid. Or, for recurring problems, they'll insert tiny ear tubes to keep things ventilated. And if a hole in the eardrum doesn't heal, a surgery called a tympanastoplasty can patch it right up. And when we talk about ear tubes, there are basically two flavors. The temporary ones are made of plastic. They're designed so that the eardrum skin slowly pushes them out over a few months, and they just fall out on their own. But for really persistent chronic infections, a doctor might use a metal tube. These are designed to stay put for several years, giving that middle ear some much-needed long-term ventilation. It is so easy to take these treatments for granted, isn't it? But when you look at how far we've come, it's truly incredible. What's now a common, treatable problem was once a life and death situation. This timeline really puts it all into perspective. Before the 1940s, a simple ear infection could literally travel to your brain and kill you. It was a common killer. Then, after World War II, penicillin came along and changed the game completely. But even then, the surgical fixes were pretty wild. In the 50s and 60s, doctors were trying to patch eardrums with cigarette paper. It wasn't until the 90s that the reliable, effective surgeries we have today became common. The progress in just a few decades is just staggering, really. We've managed to turn a common killer into a totally manageable condition. So it makes you wonder, now that this problem is more or less solved, what's next? What's the next great challenge we have to face to protect and preserve our hearing? It's definitely something to think about. Thanks for watching.